It's March 5th, 2023, day 5 after my total knee replacement surgery. Today, pretty much did the same things as yesterday. Exercises, rode the stationary bike a little bit. I didn't really ride it, just sort of used it to flex my knee back and forth, and did some stairs and walked around the house a little, waiting for the snow to melt before I attempt to go outside. So, what do I want to talk about today? Well, today I'm going to go over some of my thoughts about total knee replacement surgery and some of the things that seem like they're relatively important to me in terms of the surgery, a few details about the surgery itself from the patient's perspective, and then a little bit about recovery. Okay, let's start with what happens before surgery. Well, obviously, you've got a bum knee if you're thinking about total knee replacement surgery, which means that it hurts to walk and you may have limited mobility in that knee. And, because of the fact that you have been limited in the use of your knee and the pain on walking, you may not have been walking around much and your muscles in your leg may have been getting weak. Now, something that I have come across, and I agree with, is that your physical condition before surgery can have a big impact on how your recovery goes. Okay, first off, let's talk about how much mobility you have in your knee. If you can only bend your knee to, say, 70 degrees before surgery, I think it's going to be tough to get past that after surgery because muscles and tendons will have adapted to the limited range of motion. So, one thing I think you want to do before surgery is work on your range of motion. It may hurt a lot, but try and get that range of motion as good as you can. If you can get to 120 degrees, it's going to make it a lot easier to get to 120 degrees of knee bend after surgery. Now, what else? Strength. From my limited experience, your strength of your leg is going to have a big impact on your mobility after surgery. If you, because of your knee condition before surgery, have had a lot of limitations on walking around and using your leg, and the muscles have gotten quite weak, the surgery itself will make the muscles weaker because, it traumatized the muscles pretty significantly during the surgery. And it's going to take a lot of strengthening after surgery before you're going to feel stable on your feet. And that probably means longer on the walker before you can transition to a cane, and then a while on a cane before you can go out and walk without any kind of aid. On the other hand, if you work on your strength before surgery and build your leg up so it's nice and strong, it'll be traumatized by the surgery, but the muscles will still be strong. And that will allow you to be a lot more stable on your feet. For example, I was walking around without the walker the day I came home from the hospital, the day after my surgery. And I think I may be completely wrong, but I think that's due in part to the fact that for a month before surgery, I really worked at building up the strength in my right leg where I had the knee replacement. I did the strengthening exercises. I walked as much as I could tolerate. I went for a 1 mile walk a day and a half before my surgery. So, I did everything I could to strengthen my leg and get the leg strength to the point where even after surgery, I was strong enough that I could bear full weight on that leg, and I could stand up and the leg felt stable. So I think it's really important before your surgery to work on your strength and work on the amount that you can move your knee to get it to as good a range as possible and get your knee as strong as you can. So that's where I sit on it, but I think it's worth it. I mean, any strengthening you do will help and should make your recovery quicker. Okay, what about the surgery itself? Now, I have to admit, I was pretty apprehensive about them cutting my knee open, sawing off bits of the bones, and putting in pieces of metal, and then sort of reorganizing things and stitching it all up. I mean, that sounded pretty horrible to me. But the surgery itself was a piece of cake. I slept through it. Okay, all kidding aside, the surgery itself is not much of a big deal. Now, I opted to have a spinal anesthetic as opposed to general anesthesia. And the reason for that was that I really didn't want to have general anesthesia because I didn't want it tubed down my throat, and I didn't want to be on a machine that was breathing for me and all that. And I have heard, because I've never had general anesthesia, that general anesthesia by itself can be quite debilitating and has a recovery period. So I opted for the spinal, and they actually asked me if I wanted to be awake during the surgery. Well, I opted not to be awake. I didn't really want to hear them sawing my bones and things like that. And I have been awake during a skin cancer surgery where they cut a big hole in my face here. And I have to say that the sound of them cutting my skin was less than pleasant. So I opted to be put to sleep, and they just used a drug called propofol, which was administered through an IV, and they said, okay, here you go. And next thing I knew, the surgery was over. Now, the spinal completely deadened me from the waist down. And so I had no pain from the surgery. And when I came to, they did a nerve block in my leg just above the knee to give me a pain-free period of somewhere in the 24 to 48-hour range. I got about 32 hours out of it. So that meant that for the first day and a bit, basically I had no pain at all. I was in the hospital. My knee did not hurt. And the spinal itself was a little bit uncomfortable, partly because I knew what they were doing. They push in a tube between two of your vertebrae at the base of your spine, and then use that to inject anesthetic into the base of your spine. And you could feel them doing it. They did deaden it, so it didn't hurt, but I could feel them pushing on the base of my spine, and I knew what they were doing, so it was a little unpleasant in that respect. But, not painful. It only took a couple minutes, and then my body started going numb. And once I couldn't feel my feet anymore, they set me up for the surgery, knocked me out, and bam, it was over. So the surgery itself was not a big deal, particularly with the spinal anesthetic, because the recovery period from the sleep-inducing drug that they gave me, for me, was essentially zero. I woke up, I felt like I had just awakened from a nap. No nausea, nothing like that. I felt just fine. And the only thing I was suffering from at all was hunger, because I hadn't eaten anything since lunch the day before. So, I was hungry, and I had to wait until I got into my hospital room before they brought me something to eat. And I was on a completely normal diet from lunch after surgery on. So that was a really nice way to do it in terms of the anesthesia. Essentially, no recovery period or very little recovery period. And with the spinal block, no pain, which was great. The only issue I had was, lying in a hospital bed for a day was a little bit on the dull side, particularly since I don't watch television, and so I didn't have that to distract me. And once I was in the hospital bed, the nurses were very attentive. What that means is they're there every couple of hours, taking your vital signs, changing your IV bag, giving you more antibiotics, giving you pills, etc. And basically that makes it hard to get much sleep that first night, because you fall asleep and, oh, there's the nurse with a little cup of pills for you. Or they're putting the blood pressure cuff on you again. So that was the most difficult part of my night in the hospital. I was in zero pain, and the surgery itself was a piece of cake. What about the recovery? Now, everybody is different in this respect. I have had very, very little pain. The only pain that I had really was right after I got home, the nerve block wore off, and my leg got pretty uncomfortable. I mean, it wasn't agonizing pain or anything, it just hurt. And I didn't particularly enjoy that, about 7 or 8 hours there where, my leg just wasn't right. But I did eventually fall asleep, and in the morning, my pain was basically gone. And I have not really had any narcotics except for one 2 milligram IV shot of morphine right after the nerve block, before it really took effect, so that I wouldn't have any pain issues as the spinal anesthesia wore off. And other than that, I've just had basically Tylenol and ibuprofen. And that's all I'm on now. I take one Tylenol every 6 hours, a 500 milligram tablet, and I take one 200 milligram ibuprofen every 6 hours. And the times are staggered so that I take a pill every 3 hours. The only time I deviate from that is at night if I sleep through one of the pills, like I did last night. And I really haven't had any significant pain. Now, it doesn't mean I haven't had some discomfort. Particularly the bending exercises that you do are not very comfortable, because they aren't really pain so much as they're like really intense stretching. And that can be uncomfortable, but it goes away pretty quickly. And what I have taken to doing is, after an exercise session, I sit with my feet up and I put an ice pack on my knee. And that really helps with two things. It helps with the discomfort, and it also helps keep the swelling down. Swelling has been perhaps the biggest issue since I got home from surgery. And that has been dealt with by elevation of my legs to keep them level with or above my heart, which minimizes swelling, and by icing. I think those are things that you have to do. I'm icing my knee probably about 6 times a day. And the ice packs I'm using, I bought some reusable gel ice packs. They last about 35 to 40 minutes before they come up to room temperature. I do have an ice machine, but I've only used it a couple of times because it's kind of a nuisance to use, and you've got this thing strapped to your leg. If you have to get up to go to the restroom, it's a pain to get disconnected and move. So haven't used it very much. But, so that's kind of where I've been. Now you, if you have knee surgery, may have a totally different response to the surgery. I understand a lot of people are in significant pain after surgery. I personally believe that my lack of significant pain is probably at least partly due to the fact that I made sure my leg was good and strong before surgery, and that I had the best range of motion I could get before surgery, so that now that I'm out of surgery, my leg is still strong enough so that I can walk around without the walker. Now that's just in the house. I haven't been outside. But this next week I expect to go outside, I hope, if my wife will let me, and walk a little further and see just how it goes. I may carry the walker along with me just in case. But, I think if your leg has good strength going into the surgery, you'll come out with a pretty good fraction of that left. That will help you with stability, and it will help you to, with your exercises, will make them easier, and it will also help you to transition from walking aids to no walking aids more quickly. So that's my personal advice. Now bear in mind, although I am Dr. Dunn, I'm a physical chemist, geochemist, not a medical doctor. So my advice is probably more appropriate if you need help with your rocks than if you need help with your physiological problems. But, take it as you will. It seems to have worked for me, and none of the things I'm suggesting will cause you any problems with your recovery. So it's worth a shot to spend some time on strengthening and range of motion before your surgery, just in the off chance that it will make your recovery easier and quicker. Okay, that's all I wanted to say today. Hope you found it interesting. If you're looking at total knee replacement surgery, I hope what I've said today encourages you that it can be not such a big deal. But yeah, it's still a big deal, but it can be, not that painful, and your mobility may not be as impaired as you think it might be during your recovery. Okay, thanks for watching.